But our mission here is pretty straightforward. It's to assess, promote, and protect the public health needs of our community, enhance the quality of our environment, and ensure access to appropriate services delivered by professional staff dedicated to excellence and innovation. Next slide. So as you think about the whole public health structure in the United States, you hear a lot of acronyms, you hear about agencies, and the ones that we deal really closely with, federal agencies, are the EPA and Environmental Protection Agency, as you probably know, and then the Centers for Disease Control. We work very closely with them. The state agencies, our partners are the State Health Department. Dr. Miner is the director, and then Department of Environmental Quality, Department of Agriculture. Then, as I mentioned, there are 13 local health departments that oversee or work with in the 29 counties that we have in the state. Next slide. As you look at the local public health system, obviously you have a health department, but it takes more than a health department to have a healthy community, and businesses are certainly a part of that. We realize how important the economic situation is to having access to healthcare and having good schools and hospitals. And we are, I was just talking with a friend as I was driving in. He's the city manager of West Valley City, and we were just kind of going over different things that we're dealing with, but we both agreed we're so glad we live in the state of Utah and in the United States for sure, but the state of Utah and this community up here is just awesome. I grew up in the Salt Lake area, but the Ogden Valley and the Weber County and Morgan areas really become home these last 6 years for me. But you can see the various lines that connect, and these are all important partners in the local public health system. Next slide. Some of you probably weren't around when President Reagan was president, but C. Everett Koop was his Surgeon General. And he said something that has stuck with me throughout my career. He says that healthcare matters to all of us some of the time. Public health matters to all of us all of the time. And let me just kind of give you a few examples of why that's so important. Next slide, Ryan. So here's a day in the life of public health. I got up this morning, as you probably all did, you brushed your teeth. We had clean water, that's public health. The buildings and other places that we go to, the public buildings, are smoke-free, that's public health. Traffic laws requiring seat belts and no texting while you're driving that keep us safe, that's public health. Immunizations, and we wish we had an immunization for COVID-19, but those immunizations of other communicable disease protect us from disease, that's public health. The restaurants that we visit and the swimming pools that we go to, the public swimming pools are all inspected, that's public health. And then as we try to message about outbreaks and other ways to stay healthy, that's all public health. Let me just give you a little perspective. Next slide. We go back 100 years and things were quite different back then. There were about 8,000 cars in the US, only 10 miles of concrete pavement, few spray cans to destroy the ozone layer. Everyone ate natural foods. The air was relatively unpolluted and the ground was free of aluminum cans. There were no sugar substitutes and no artificial coloring. We had no atomic waste or PCBs, and our average life expectancy was 47. The year was 1900. Next slide. Today, some may say we're doing everything wrong, and the life expectancy is up to 79 years. And if we're not careful, it could hit 90. Next slide. So that's a lot of life expectancy over 32 years in over a 100-year period. Since 1900, the average lifespan of persons in the US has lengthened by greater than 30 years, so actually about 32 years. 25 years of this gain are attributable attributable to advances in public health. Let me just give you some of the major achievements in the past 100 years. So back in the early 1900s, and when the Spanish flu came through in 1918, that killed over 670,000 people in the US, we didn't have vaccines. We didn't have ways to control it. And our public health practices back there were not nearly as good as they are. We didn't know as much about that. It was, we were still learning about the role that sanitation and that played in public health. But vaccines, for those that can remember, smallpox and polio, they've been eradicated. I know growing up, I had to get got a vaccine for smallpox, and I had relatives that experienced polio. Very difficult. We've been able to control measles and rubella and tetanus and diphtheria, pertussis, and other infectious disease because of that program, and that has added life expectancy. Next slide. And motor vehicle safety. If you're like me, growing up in the 60s and 70s, few of us really wore seatbelts. I know I didn't wear a helmet when I rode my motorcycle. Just wasn't stressed like that. But because of safer vehicles and highways, increased use of seatbelts and car seats, motorcycle helmets, decreasing the occurrence of drinking and driving, and no texting and driving, we've seen great strides. And that has helped to increase life expectancy. Next slide. Safer workplaces. I was in St. Louis and went through the arch just this past summer, and was very interested to watch how they built that arch. And they had calculated, and this was in the early 60s, they kind of planned that there would be a few people that died because of the difficulty doing that. They certainly weren't strapped in, they weren't following OSHA. But it was quite an achievement to build that arch, and fortunately no one did die, but they thought around 3 to 6 people might because of the difficulty, the engineering and all that. But we've come a long way. 40% reduction in the rate of fatal occupation injuries since 1980. That's a big deal. Next slide. Control of infectious diseases, and that kind of strikes home with what we're dealing with now. Clean water and improved sanitation has done so much. If you go back to 1848, there was a huge cholera outbreak in London. Hundreds, if not thousands, of people were dying of cholera. John Snow, who is credited to being one of the first epidemiologists, was the first one to start plotting where, the houses that people had died, and he plotted that. And then he started plotting where they were getting their drinking water. And as he did that, it brought him back to the Broad Street pump. And as they investigated further, that pump was drawing water right where wastewater, the sewage, was going in. And so by removing the handle on that pump, they were able to solve that problem. And from then, the connection with bacteria and viruses and that was being made and began to improve ever since 1848. But that was one of the huge breakthroughs in communicable disease. And then there's TB that we've been able to control, and we're still working with sexually transmitted disease and the therapy that we've been able to develop to help control those diseases. Next slide. See, that didn't pop up. There we go. So there's also chronic diseases, a decline in deaths from heart disease and stroke. We've seen since 1972, death rates for coronary heart disease have decreased 51%. Next slide. Safer and healthier foods. This is really important to note. We're fortunate to live in a country that has high standards, and we've been able to almost eliminate the major nutritional deficiency diseases that have plagued other generations. Next slide. Healthier mothers and babies. With the public health, with our health department, we are very proud of our Women and Infant Children program, the WIC program, that helps mothers with better nutrition and access to health care, and also helps the children up to age 5 so that they get the nutrition support that they need to grow and be healthy. Since 1900, infant mortality has decreased by 90%, and maternal mortality has decreased by 99%. Next slide. And then the whole tobacco issue that we've been dealing with for almost 60 years. Since the 1964 Surgeon General's report on the health risks of smoking, the prevalence of smoking among adults has decreased, and millions of smoking-related deaths have been prevented. And it hasn't been that long ago, but we realized that secondhand smoke was a big problem in the 80s, but fortunately, Utah was one of the first states in the nation to pass a Utah Indoor Clean Air Act, which prevented people from smoking in public places, and that has played a big role. And then preventing youth access to tobacco and e-cigarettes is still a challenge. And we've made great progress with tobacco and cigarettes, but e-cigarettes has caused us to have to go back to the drawing board on some things. But we are making strides, but that is very popular with the youth, as you know. This slide, I just want to just quickly go over this. This is really something that we spend a lot of time talking about and realizing that there are so many social determinants of health. Everywhere from interpersonal violence, you can see education, food insecurity. There are people that don't know where their next meal, even in this wealthy country, we have people that don't know where their next meal is coming from, and that certainly presents public health problems. Family and social support. And then income and employment is such a big part of health in our community. We realize that. Having a place to live that you can call home, and then of course healthy behaviors is part of that, and transportation we are very dependent upon to get where we need to go. So those are just some thoughts in a very quick presentation about Public Health Principles 101, and hopefully that serves as a foundation to talk a little bit about COVID-19, and that will be the next slide here. So on February 11th, 2020, the World Health Organization announced COVID-19 as the official name for the novel new virus causing the current outbreak. And we're all very familiar with that name now, that such a little virus could cause so much havoc. Next slide. Let me just give you some updated numbers. I was just looking at the state numbers, and they're not on here, but we follow those really closely. So if we look at the slide, you can see that the total cases that we have in both Weber and Morgan County is 108. Now that recovered isn't right. I know that's in the 30s. There's one death. And then there's been over almost 3,200 tests given. So we're below, for every 100 tests, we'll find less than 5% positive. So that's good, but we'd like to see that even lower. And that's one of the things that we're monitoring, because what we're finding is that whether we give 3,000 tests or 3,000 tests are given, or if there's 600 tests during that particular day, it's always right around 5%. What we'd like to see is that starting to drop, the percent positive rate drop below 5%. So we're watching that factor. And then you can see the various counties and the age groups. The majority of cases are in the 18 to 60, almost 80 of our 108 cases, well, 80 of our 108 cases. And then this divides it into the counties. So 101 cases in Weber and 7 in Morgan. As you look at the state, there's been, as of yesterday, there are 2,412 cases, 46,476 tests, and hospitalization, there's been 213. In Weber Morgan, we've had 9 as of yesterday that have been hospitalized, and then 19 deaths. So all those are things that, you know, are important to track and to analyze as we work through this outbreak. Next slide. So just a quick history of the last few months, just kind of a reminder. January 21, the Utah Department of Health Command Center activated their incident command system. On March 2nd, the Governor's Task Force, bringing health and law enforcement education, they did a unified command beginning that on March 2nd. So we saw what was happening around the world, particularly over in China, was watching that very carefully as it went over to Europe, watched what was happening in Italy. We were bracing ourselves for when it came to the United States. Our first case in Utah was in Davis County, and that was March 6th. I can remember exactly when that came through. The second case was surprisingly not in Salt Lake or some of the bigger counties, but it was here in Weber County on the 9th. And then since then, we've had 2,412 cases. And as a result, local governments, state governments declared emergency situations in order to get FEMA funds and state funds. You have to declare an emergency situation, and that was done. And along with that, we gave our first public health order that limited mass gatherings. It was limited to about 100. I think it was 100 at that time. And then food service and takeout. Pretty much we did everything that there with food service that is still in place to date. And then on March 24th, governors, and to their credit, did a Leads Together campaign, and he did his directive on March 24th. Stay home as much as possible, keep 6 feet apart, temporary closures of salons, body art, fitness centers. And so we talk regularly, not always daily with the state health department, but we're in contact, which I think is very important that we have those communication lines. Local governments can be more restrictive than state government, but they can't be less restrictive. And so we're very interested every time the governor and his staff with his consultants, and he has reached out to locals to get our input, which we've really appreciated, both at the elected level and also the public health level. And so our orders, our second and our third order, have been in line with what the governor has asked in his directives to do. And so that kind of brings us to our directive. Next slide. And so what we've done in this last extended order is divide the public health order and directive into 2 sections. One, a directive, which is a strongly recommended, strongly encouraged area. And then the order is actually what is enforceable by statute, by law, which are generally Class B and Class A misdemeanors, citations, those sort of things. So the directive to stay home as much as possible, only leaving for essential services. This is not a shelter-in-place order. That needs to be clarified, and we've tried to do that along the way. We've encouraged people to use telehealth, no team or contact sports, stagger shifts at work, employee screening, exclude sick employees and their patrons. Daycares are open, but in groups of less than 10. So all of that. And then this last directive, we added private nightly rentals are discouraged. And the reason for that is bringing in people from outside our state during this very critical, urgent time to social distance didn't make sense, wasn't in line with what the governor was asking us to do, to only travel when essential for business and to stay at home and as much as we could to stay safe. So we tried to do that in the spirit of what the governor was asking us to do, along with our elected officials, tried to message so it was consistent. And then the order part, next slide, actually has the ability to enforce with law enforcement. Of course, that is not our goal at all. Our goal is always to give you facts and information, the correct principles, and trust that the community will do the right thing. And I think overall the community has done the right thing. We've felt the support of both business as they've been asked to do a lot of sacrifice this time in order to achieve the goal of social distancing. And then those that test positive obviously need to be quarantined. And then as a public health department, we work with them and check in with them daily, see how they're doing. And then also the contacts to those positive people that have had close personal contact, we monitor them for 14 days in order to keep everyone isolated and as safe as possible. And then those businesses that were unable to abide by the 6-foot social distancing guidelines were closed during the, what was it, the March 2nd order, I believe, and then that's continued until May 1st. Restaurants continue to be open just for drive-in and drive. No, they're open. Restaurants are not open for dine-in. And that's a mistake there, a typo. They are not, but they are for drive-through, delivery, or curbside, ordering by telephone or online services. And then employees who handle payment transactions may not prepare food, and we've got good practices for them. And it goes into a lot of detail, and I'm not going to take the time to go through all that, but encourage you to read it. It's on our website. It's certainly published and available. And you could get more information. And certainly if you have questions today, we can talk more about it. Next slide.
Brian?
Yes.
This is Chuck. We have a clarifying question on this particular slide with respect to the order.
Okay.
Who is responsible for enforcement of the order?
The Sheriff's Department, so Weber County Sheriff.
And how have they had to enforce any of those to date that you're aware of?
We've had 3 non-compliant individuals dealing with, they're homeless, and so they also had mental health issues, unfortunately, and they wouldn't stay isolated, so I had to do a restriction order that goes along with communicable disease. And so we opened a facility at Weber Human Services there that has 16 beds, so we could get them out of the shelter and that we could give them a nice place to be where they're comfortable. But we did have to use law enforcement as well as EMS to transport them and get them there. And all three became compliant once we got law enforcement, but that's very unusual. Everyone else has been good as they've been tested positive or they've been in close personal contact. We stay in touch with them, and I think have done a very good job of staying isolated.
Thank you.
Yeah. Okay, so just something that's on our website, but just a quick reference. You can see what's been closed. You can see the restricted, what's been restricted, and then what's operational. So that's just a good overview of what the public health directive and order says. Next slide. So what are our goals? What are we trying to accomplish with all this? And I think you probably heard it from the media, but let me just go over it quickly. And I think this slide really helps. When there is a pandemic, and we're talking about particularly the symptoms that we've talked a lot about with COVID-19 are fever, cough, and difficult breathing. And then the main tool that we have in our bag of tricks to deal with this is social distancing. And so we've tried to do that with stay-at-home orders when you're out and about, to wear masks, or certainly do all you can to keep your distance. 6 feet is always what we've talked about. And all of this is done for the purpose of flattening the curve. We know that we can't prevent all this illness, but we can certainly be smart with how we deal with it. And the reason we want to flatten the curve is to minimize the impact on our medical system. And you can see the example there at the bottom left-hand side where you have the number of cases. And as the number of cases climb, then that puts a burden on our healthcare system. And if we get too many cases too quick, it can overrun the healthcare system. And that's what you're hearing about in New York City. They have 17 hospitals there. I have a friend that just went back there last week. She's a nurse, and she went back with a friend that served a mission there, and they just wanted to help. They saw a need and they wanted to help, but they were not prepared for what they saw. They were assigned to a hospital in Queens. The hospital had 300 patients. They were all COVID positive. It was bursting at the seams. They did not have enough PPE. So she was given one mask, one N95 mask that she had to wear the entire shift. And typically, anytime you change patients, you change that mask. A gown she had to wear the whole time, and gloves. And a typical patient load for a nurse in that type of setting is 7 to 10 people. She had 25. They had one doctor on that whole floor, and it was crisis management. There's no longer the protocols that we've come to expect with good healthcare system like we have here, and a great healthcare system. And once those barriers break down, then you lose control, and you're just trying to do all you can to help these people. And she said once they're put on a ventilator there, because you can't be with them to help them and watch the oxygen, it's pretty much a death sentence. And then just think of all not having enough PPE and then going home to your family. So she worked one 12-hour shift and thought the risk, as much as she wanted to help, she just could not. She has 2 young kids, she has a husband, and she says, I can't do this with lack of protection. And the turnover in those hospitals is whether from sickness or from people quitting, just in the people that she was working with in that one shift, the nurse that had the most experience was 5 days. So very little training for this whole situation. So my heart goes out to those people. And this is what we're really working hard, that we do not even come close to having to deal with anything like that. And so far with our interventions, we have enough beds, we have the capacity to treat those that need it. And that is the reason that we're doing what we're doing and have taken the measures so quickly. The governor recognized quickly that in March we needed to close the schools. And then we've tried to look at it in 2-week blocks and decide how best to deal with it, looking at the data, and then take the next step. This last time when we extended the orders, we didn't tighten anything, we just extended them, and for another 2-week period to really get a handle on this. As you know, the legislature will be meeting beginning tomorrow. They're going to be working on funding issues, but they're also going to be talking about when will it be appropriate to open up things and roll things back, which is very important to start to have those discussions. And I think businesses should have plans what it would look like as employees come back. You know, how can we ensure that they're healthy and screening, and are we even going to have masks or anything available to protect, and those sort of plans. And so there'll be a lot of discussion here in the next couple of weeks on what things will look like in May. But right now, we are committed to stay the course for another 2 weeks. We are seeing lots of reasons for hope as last few days numbers have gone down substantially, but also the testing's gone down because some people are not, maybe that could qualify for a test, are not seeking tests. And that testing has been very difficult. First, we didn't have enough tests, and now we've got plenty of tests, and we're not getting as many people tested as we think that should be tested. So we're going to continue to message and let people know that yes, tests are available, and if you present with, and they've even extended the symptoms from just the cough, difficulty breathing, temperature, and then they've also included body aches and a couple of other factors that they would consider testing, lack of smell and taste, and I can't remember what the other one is, but just off the top of my head. So there's a lot of meetings. I spend a lot of my day in meetings trying to figure this out with the state and try to decide what is the best next move for not only the state, but each of our communities. Next slide. So the whole plan with the state is, and the governor announced this back, I think the last of March, was what we're dealing with right now is that urgent phase. When we look at the path to recovery, this is the urgent phase, and it is expected to go 4 to 8 weeks. Well, it's already gone 4 weeks, and by the time we get to May, it'll be 6 weeks. But the whole plan is to maintain aggressive social distance measures, to protect our hospital capacity, increase and deploy testing capacity, and maintain the supply of essential medical items so that when those people catch the disease, and if it's not just mild or moderate, that becomes difficult breathing and those sort of symptoms where they need to seek medical care, that they have the best medical care possible, and that we can provide that. If we overwhelm the hospitals, they will not be able to provide that, and that's where we'll see increase in mortality rates, and that's what we're working very hard to make sure that doesn't happen. And then what we'll be talking about is how do we move to that next stage of stabilization. So I think we all agree that social distancing will need to continue, but it could be more targeted. It could be something that's a little more careful. Other things could open, but we need to be smart about it, because what we're trying to avoid is that a second wave, which we're already hearing that they might be seen in China. High-risk populations continue to stay at home, and those high-risk populations are those that have immune deficiencies or those that are 60 and older. And then group gathering limitations soften. You know, we went from 100, we were talking about going to 50, but in that same day, the federal government went to 10, so we went to 10. And then last time we went to no social gatherings, and that's where we're at. We strongly recommend not gathering socially. But I think they would soften, and then you would go back to maybe 10, groups of 10 in social gatherings, 50, 100. But before you see thousands of people back together again, I think you're looking at several months, and that's just my opinion. But that's not going to happen overnight. But I think there are ways of looking at this and being calculated and using the data to make good best practice and scientific decisions as we do this. One thing we don't want to do is have to start all over with something that we move too fast to get back to normal, and then we see an increase of and we overwhelm our healthcare system.
Brian?
Yes.
Another clarifying question. How many waves would you expect to see from this? And would they be global waves, or are they restricted to certain geographic areas?
That's a great question. I really don't know the answer. All we have is to look at history. And if you look at the Spanish flu, there were 3 waves, and it took a couple of years. But they didn't have the ability that we do to develop a vaccine, and there's one in the works. There's several of them that they're looking at. So the game changer for COVID-19 will be better treatment with better medication for people that get the disease, and then ultimately a vaccine that will help prevent it. And so until then, the tools that we have to deal with it are what we're doing right now, is the social distancing and doing all we can to protect our healthcare system so that we get the best care that we can for those that become ill. So does that help?
Yes, thank you, Brian.
Okay. All right. Well, what role do businesses play? Well, obviously, it's a huge role. They give us this great way of life, this standard of living that we've all come to enjoy. And as we come back and as we roll these things back, what are the points of congregation? You know, sharing equipment. We're going to have to pay a lot more attention to that initially, for sure. We should always pay attention to that, really, because we know that disease is transmitted through body fluids, and that's no secret. And coughing and sneezing in public is a way that we transmit a lot of diseases. And then, of course, the virtual services, and I've been so impressed with both business and our education system, trying to keep business going and then also our kids learning. And we're fortunate in Utah. I don't think every state has that ability to do what we're doing. And is it perfect? No, this whole thing is not perfect. We're all trying to put our heads together, learn from history, and do the best we can with the information that we have. And then employee screening. And then as they identify ill people, that they get tested, and that we identify their contacts, and that we work with them to make sure that they're isolated, and so they get out from the general population, so we have less spread of the disease. And I think, I don't, this is just probably more detail than you need as far as COVID-19. Let's see what the next slide is. These are prevention at work strategies that we've I've mentioned. We have really good posters. If you don't have them, we have some online. We certainly, as a health department, be happy to get you any information that you would like that would help you as you help us fight this virus. Next slide. And then I think there's things as far as stopping the spread of germs with individual prevention. Next slide. And then you're probably aware that Weber County has great business assistance. We have a Weber County Economic Director, and here's the information there for Holland. If you want to reach out to her, if you haven't already, she's a good resource as we try to work through these difficult economic situations. So I think with that, that's all I have. Ready to take any questions that you might have.
Great. Thank you, Brian. We have a lot of questions, and hopefully we can get through some of these. Some of them are related, and you can maybe pool some of these together. There are, seems like there are some high interest areas in particular for the fitness industry, and those who are involved with the fitness industry. We see Box Elder County, I believe Cache County relieves some of the restrictions on that. Where are we on that? And do you expect us to follow suit in that order, relieving some of those restrictions, or do you see them staying put? And if so, why?
Okay. Yes, I believe along the Wasatch Front, it's Salt Lake, Davis, and us that have the restrictions or close the gyms. Bear River Health District, so that's in Cache, Box Elder, and Rich. They have less than half the cases that we have, and they're trying something. They are going to work with the fitness facilities and the gyms to do some social distancing. So we will really watch very closely what they do and what type of outcomes, what does that do to their numbers. But we want to stay the course for the next 2 weeks. The salons and the gyms and swimming pools and those recreation centers are still closed until May 1st.
Okay. Do you have any indication of this is respect to the flattening of the curve? The flattening of the curve is seen as detrimental to small business in particular, because the longer that we spread it out,
right,
the more that it hurts our businesses. And so how do you see that playing out with respect to our businesses? And is there certain minimums, I guess, minimum standards that we have to meet in order to begin reducing the social distancing and coming back and rejoining?
Now, that's a great question, and yes, we're very sensitive to that. And really, the whole strategy that we've had is to try to keep as much business open as it makes sense at the time, and I think that will continue to be the philosophy. What we need to see is the percentage of positives going down. So I talked about, doesn't matter if we do 600 or 3,000, we're still seeing 5% positive. So that's telling us that it's still out there and we're not seeing a reduction through people getting, well, we know people are recovering. We've had, and we'll continue to recover and develop antibodies and that, but we'd like to see that number drop. And then the number of cases, daily cases, go down and stay down, where we feel like we could roll back some of these things. And I would think businesses that have plans and can work with us with social distancing and that, again, a lot of businesses have just closed on their own. Because they haven't been able to maintain it. We haven't ordered them closed. They've just done the right thing given the situation. But I think as we all get more comfortable with it, and I think every day we are getting more comfortable, but I think we really do need this next 2 weeks to have a good discussion about how do we thoughtfully go about doing this in a way that will be responsible and that we won't regret in a month or two that we've done it too quickly. So the legislature, this is going to be a hot topic with their session. And then as we meet regularly with the state and the governor, he's always asking us input where we're at. And I think rural areas are going to be able to do it quicker than urban areas. It's just that whole social distancing. But, particular businesses that may not impact. So we're going to have to be very thoughtful about that and certainly welcome suggestions and feedback on how to do that. But it's certainly not done in a silo. We do it with feedback from our community. We do it obviously with elected officials, and have to have all that, the support of the Board of Health and everything before we do any sort of directive or order, which is how it should be. I mean, this is not a decision that one person makes.
It appears from our perspective as a collective businesses that our businesses are working extra hard to voluntarily do the right thing. And that's what I see. I see a ton of effort being applied to this. And because of that volunteer effort, does it make sense to relieve some of those restrictions so that businesses can continue to do what they need to do while still doing the right thing?
Right. Yeah, and I think as we keep those principles in mind, that we can do that. And that's the thing, because then it really falls on the business that has the responsibility to ensure that happens. Obviously, as a health department, we don't have the staff and certainly don't want to have law enforcement involved in things. But as a community, we all have to take ownership that, protect each other, listen to the facts, pay attention to what the experts are saying, and then try to craft a way to do it so that we don't kill business, because that's always been the plan, is to work collectively together and figure the best way through this whole thing. And that's why we've done it in phases, and I would assume as we come out of it, we'll do it in phases as well. It won't be May 2nd and then everything's back to normal. But I could see that there will be a lightening, and that's my hope, is that's what we start to see come May 2nd, that a few of these businesses that have been closed, we can, and it would make sense that some of the salons and spas that are smaller, but opening movie theaters where people are really going to gather and those sort of things probably doesn't make sense right off the bat. So it's that whole social distancing and then not having big crowds.
Yeah, that makes
how do we do that?
Yeah, that makes complete sense.
Yeah.
A couple of these questions, seems like there's some interest here just with, as we pull out of this, and there's some questions about the actual disease, and this is something I think is very appropriate to address here, is can individuals get the disease after they've had it? And are there follow-up testing going on for those who have had it? Do they have a follow-up test and to indicate whether or not that's happening or not? And then if you could also address where we're at on the vaccine, if there, do you have any indications that we're making progress toward a vaccine, and how long before we may see something?
They're working very hard on a vaccine. I can answer that first. They are testing several different mixtures, or I don't know all the details on that. I know that it's in the process. But everything that I've heard, by the time they get approval and everything, you're looking at over a year to 18 months is the information that I've heard from Centers for Disease Control and some of the physicians that speak with the president. That's what they're saying. And your other question is, if you've had the virus, can you get it again? And they're still learning about that. They're still trying to figure that out. We know that you can be asymptomatic, so without symptoms, and you can spread it. And we think up to about 48 hours before you start to show symptoms. But, you know, there still needs to be a lot more research. We're very hesitant to say things based on small samples. And this research will be coming out in the next few months. We'll have a better idea of how this goes because this is totally new. It's a novel virus. Sometimes it acts like what other viruses does, and other times it's different. This is, and that's just what we're trying to get a good handle on. And the more we get comfortable with how this virus responds and that we can get the medication that can help treat those that get the disease or even helps prevent it to some degree or lessen the symptoms would be awesome. And that should be coming. You've heard a lot about the medication that was treated malaria. It contains zinc and other medicine that we'll be getting about 200,000 doses to the state of Utah. It's been very effective with malaria and those sort of things, and they think that there's a chance that it will work. People have tried it in other countries. They're trying it in other states. People are getting better. Now, is that because of the medication? How much is that because of the medication, or is it just that their body fought it off and they recovered? So we don't have all those answers yet. It's really too early in the process, but those are things that even the University of Utah has received a grant for. They're trying to see if this thing's going to be seasonal. You know, is it going to be like the flu? Will it lessen? There's some evidence to show that it will lessen in the summer, and it might be a seasonal thing like the flu, but I don't think we have any hard evidence at this point where I'd feel comfortable saying that, yeah, exactly, this, and this, and that's the way it is, because we just don't have that yet.
As you can imagine, we have several questions directed to specific industries. Bars, swimming pools are a couple that have been noted. How do you address these individual needs for different types of businesses, and where should they go to get answers on how do they proceed? How can they continue to do business? And what can they expect in the future? Who's answering those types of questions? And how would you expect a business to proceed in this kind of climate? What advice would you give them?
Well, I wished I had an economics degree and all that. I mean, just to be honest, obviously we're aware of that, but we are so overwhelmed with just dealing with what we're dealing with day to day. That we don't have those answers as a local health department. We are anxious to hear again what businesses would recommend, and you know the governor has his task force, economic task force. I would certainly listen to them. I know that the counties have their economic development people, and we talk with them. Our goal right now as a local health department, and our focus is ensuring that the best public health practices out there and that we're following it, which we are, which is social distancing, that the people that get the disease get isolated, okay? And then we then contact all the people that have been in direct contact with them and make sure that they isolate. And in order to prevent the spread. And then we have the responsibility with the homeless as they become positive and they don't have a place to isolate. We have a facility that we've got going, and so we work with them. And then the whole PPE, as the state gets this protective equipment, it then goes out to the hospitals and it comes into us as a local health department. We distribute it to the long-term care facilities. And right now, the highest risk are the long-term care facilities and the homeless right now, because they don't have a place to isolate, and we don't want them in the shelters. So those are things that are, as you look at priorities and as you look at local health department, that's our focus. And I really think these other things are really important discussions to have, and we certainly will weigh in on them, but I wouldn't pretend to know the best way to do that right now. If you can kind of appreciate what we're trying to do as a local health department, we've that's our entire focus, and we have to do that well in order to get through this urgent phase. And if we get through this urgent phase, then we can start to weigh in more and think more thoughtfully about that. But I would just be blowing smoke if I told you I knew exactly how that was going to all roll out, because I don't know at this time. Sorry.
Well, we appreciate that honesty and realize that we're all learning.
Yeah.
We appreciate you putting your contact information here on the slide in front of you, Brian. Would you be open to individuals contacting you with their specific questions beyond this, if they have those pertaining to the
Absolutely. We have a website that could be helpful, and we have a lot of guidelines there. But yes, as they have questions, they can actually email me, and I will see that I'm fortunate that I have a lot of good staff that I can delegate to, and I would certainly take everything that they have very seriously and make sure that we follow through. And if we don't have the answer, we'll find someone that can help them. So
thank you.
Happy to do that.
Thank you, everyone, for your participation. We're going to let Brian go. I do want to just put a plug in for, you had some information at the top of your Zoom chat there. We have an upcoming spring symposium in 2 weeks. That's going to be on April 29th from 9 a.m. to 10:30. This event is, again, because of our partnerships, free for all chamber members. This is usually a paid for event, our symposiums, but it's going to be a virtual symposium. And the title of it is Adapting Sales and Business Development Cycles to the Changing Environment. So how do we adapt what we have been doing to this new environment, and in particular, continuing on with our sales. And so we have 2 mini master classes. One is being taught by Tim Border, who is Associate Professor of Sales at Weber State University, and the other by Adjunct Professor Diana George. And these are going to be great discussions, about an hour and a half long. It'll be well worth your time. We encourage you all to get on our website and register. You do have to register for the event in order to get the passcode. They are for chamber members, and this is free for your chamber membership. Thank you, everyone. We appreciate all that you do for the chamber, for your business, for our community. We love you. Thank you so much. Have a wonderful day. Take care.